This is Ricardo, Century 21. Whether you're looking to buy or sell a home, I'll make sure it's the right fit. So we are here again with Dr. Eddie.
Yeah,
Thanks for your time.
Yeah, exactly.
So last time you made the introduction to the audience. Now I want to talk about, one of the things I know personally that I was experiencing, which was low testosterone. And you actually educated me, and I would love to hear a little bit of, what you're experiencing out there and what maybe a lot of people don't realize some of the symptoms that is due to low testosterone.
It's a great question, Ricardo, and that's what I see a lot in my office. People are asking three simple questions that most doctors don't want to even discuss. One, how's your energy level? Everybody wants to treat the diabetes, the high blood pressure, the cholesterol, do the annual exam, set up for colonoscopies, but just a simple, basic question of why we go to the doctor to get healthy. How is your energy level? How is your mood? In a scale of 1 to 10, you should be able to tell me. And how's your libido? That's the biggest question that most doctors, I feel like, don't ask, don't address. And I have patients here that see the OBGYN and I ask them, how's your libido? How's your sex drive? Wow, are you having sex with your husband? Or vice versa, you're having sex with your wife? And that's the biggest question that's raised and that I get answers. They all say my sex drive is horrible, it's bad, my energy is low, my mood is, that's a weird question to ask at a physician's office. They don't expect it, Yeah. And based on those levels, I said, let's get some hormones, After your late 20s, you lose about 1% to 2% of your testosterone levels every single year. So you can imagine at age late 30s, mid 40s, you get what we call andropause, basically menopause for males, and it's a depletion of your hormone levels. And so you could be working out, eating healthy, right diet, right fitness plan, personal trainer, everything, and not see the results in the gym because your testosterone levels are low. And you need that. That is the male hormones, the male sex hormone that makes us men, that gives us muscle, that gives us strength. And women have a certain amount of it too, a certain amount, 1/10 less than what men do. And so they need a certain amount of testosterone too as well. And so when women on birth control pills, they actually deplete their natural testosterone. And that's why sometimes postmenopausal women get bioidentical hormone replacement and they get testosterone supplementation, And same thing with men as well. So 3 simple questions, and ask yourself this: what is your energy level 1 out of 10? What is your mood 1 out of 10? And what is your libido 1 out of 10? And if you're thinking too hard on this question, most likely I would ask your doctor or healthcare provider to get your testosterone or hormone level panel checked.
Wow. Now, Eddie, I know you're actually, the thing I love about you is, you're out of the box thinking and, solutions that you provide. I was so used to hearing about testosterone means injections. And you actually educated me on pellets, and just a quick overview of what that means.
So testosterone comes in many forms. It can come in a cream, it can come in an injection form, it can come in a gel, it can come in a deodorant, it can come in what we call a troche, basically a pill that you can dissolve underneath your tongue. But what type of testosterone are you taking? Synthetic or bioidentical? And bioidentical hormone replacement is a natural form of testosterone replacement. It's not FDA approved. There's no research studies on it, but it's because it's natural. The FDA has no regulation over that. Bioidentical is taking the same key for your house, and putting it into the lock. It's identically the same to your natural testosterone hormone. Synthetic testosterone, it's getting a copy of that key made. It fits, it moves, but it's not quite the same like the original key. Okay. From my experience, anecdotal evidence, there's less side effects, I feel like, with bioidentical hormones in terms of, men hair loss, cholesterol abnormalities, getting frequent blood donations that you see with traditional testosterone therapy. And with my patients, I give them the option. I talk about traditional testosterone therapy, whether it's a cream, it's a gel, or it's an injection. And with bioidentical, you do have an option. It doesn't have to be pellets. It could be a cream, bioidentical cream replacement, or a gel. It's just basically extracted from yams. They compound it at a compound pharmacy, whether you want it in a gel, in a cream, or you want it in a pellet. And the pellet, I think, is the best mode of therapy. And what a pellet is, it's a small size of a pill, either testosterone or estrogen or progesterone, depending if you're male or female, a pellet that gets implanted subcutaneously under the glutes, basically your left or right glute. And based on your cardiac output, based on your heart pump, when your heart pumps it, touches it, and it slowly releases throughout the body, it gives you steady concentration of hormone levels, and it lasts anywhere from 6 months. So you do the procedure once for a male, it lasts anywhere from 5 to 7 months. For female, it lasts anywhere from 3 to 4 months. And and that takes the burden away from a lot of my patients, where they don't have to inject themselves every week. When they're traveling and they have to bring the needles, they have to get a special letter from the doctor when they go into a different country. Most people, common sense is if you're having a 1 in 3 fever, you're having a flu, you're not going to introduce a needle into you. They're afraid of injecting. So here you do the pellet procedure once. I check your levels in 4 to 6 weeks, and then every 6 months we redo the levels, and then we put more pellets in there. And it gives you steady levels without the side effects, without the spikes. People who do injections, they feel good on Monday, and on Thursday they're crashing. But the injections I do for another 3 days. Plus, they build a lot of fibrous scar tissue that they don't want, and the pain and the risk of infection that you get from it. So,
wow, I mean that's a lot to digest,
I
but
know.
it's worth drinking and eating. So.
Still gotta eat healthy.
Exactly. Thank you so much for your time. Please let them know how they can get in contact with you.
DrEddieFatahkov.com. You also can go to the website www.centerforinternalmed.com or CFIAIM.com. I'm here in Alpharetta. I'm part of the community, and I definitely want to address your healthcare needs.
And again, this is Ricardo, your personal training realtor for all your real estate needs.